Let's say you're in clinic for a routine checkup. At the end of the visit, your doc says they're going to draw some blood and check a few things out. And you think, sure, like whatever. You get your blood drawn, you go on with your day. Next evening rolls around though, and you're sitting on the couch when your phone buzzes. You've got a notification that those lab results from yesterday are back. So, what do? Do you check the results now and potentially get very serious information that you may not know what to do with? Or do you wait for who knows how long to hear directly back from your doctor and walk through it? Believe it or not, there is a debate about whether or not that should even be your choice at all. Yeah, buckle up. We are going to review the legislative changes that have given you essentially instantaneous access to your healthcare information, including lab results, and how this may impact your relationship with your doctor. Then we're going to rewind back to that opening scenario before that needle goes in your arm and arm you with 3 questions to ask your doctor so that when you do get that notification, you know what to do next. I'm Dr. Tyler, and this is How to Train Your Doctor. All right, so we are now living in the era of the 21st Century CARES Act. No, Cures Act. It's Cures Act. I always get that wrong. We are living in the era of the 21st Century Cures Act. This was a big piece of legislation passed in 2016, like $6 billion big, that included a lot of provisions in it, one of which was a prohibition on healthcare systems blocking your access to your healthcare information. Now, it's taken some time to kind of implement this in the electronic era. The old coronavirus set things back just a bit. But essentially, these days, you have instantaneous access to all of your medical stuff, your doctor notes, biopsy results, imaging, and your lab results. All of it. Now, docs and patient advocates are a bit at odds on whether or not this is all a good thing. There was a great piece in Politico this week by Ben Leonard that outlines the argument here. I'll link that in the notes below here so you can check it out because it's a good read. But essentially, on one side, you've got docs saying that if you give patients access to everything instantaneously, that will include bad news potentially. And doctors would prefer that if you're going to get bad news, that they're there with you either face to face, on the phone, to walk you through it. Because a worst case scenario, you get bad news after hours, and you're trying to call the clinic and no one's available, and you're just sitting there at home anxious and worried and not sure what to do. Now, patient advocates are pushing back on that and saying, well, hold on, no one is forcing anyone to check those lab results. If you want to wait for your doc, you can wait for your doc to call you or see them in clinic or whatever. Meanwhile, there are a lot of people that would like to prepare ahead of seeing their doctor or talking to their doctor, meaning they would like to get those results right away so they can get to researching and preparing questions so that way they can have a more productive conversation with their doctor and get to game planning it as soon as they're in that conversation. Maybe you're one of those people. Which side you fall on in this debate, honestly, is, I think, fairly irrelevant. This law isn't going anywhere. So let's focus on how this all impacts your relationship with your doctor. Because here's the thing. Docs aren't necessarily going to prepare you for what to do with lab results if you get them before they do. So if you want a game plan, you may have to initiate that conversation yourself. So what would that look like? Well, let's do the rewind. Let's go back to that opening scenario. You're sitting in clinic, your doc wants to draw some blood. Here are 3 questions that you can ask your doctor to get a better sense of how the information is going to flow and how to prepare for things as the information comes in. First question, when and how should you expect to hear back from your doctor? The when meaning how long does it take for this test to come back? How long would you expect to be sitting around in radio silence before something is up, right? Because some tests take hours to come back and others can take weeks to come back depending on the test. So get a sense of what to expect on the time range. And then the how is, how is your doc going to contact you? By phone, by email? Do they want to see you in clinic? Are they going to message you on the patient portal? There's so many different ways to contact each other now, it can get confusing. So make sure you understand how you're going to reestablish contact. And hopefully that'll give you a sense of when do you need to personally reach out if you haven't heard from anyone. 2, what should you do with an abnormal result? And specifically, where should you go if you get any sort of result that is abnormal? And by where, I'm talking 2 things here. Where should you go for information? Like, what are the trustworthy resources your doctor recommends to research what you got if you can't talk to them right away directly? And 2, where would you physically go? Like, if your result is so abnormal that you've got an emergency on your hands, Well, what would constitute an emergency in the first place? Because not every abnormal lab result is an emergency. Some stuff is like sort of abnormal, but not emergency normal. And other stuff is emergency normal, like get to the ER now. So, get a sense of, what would really abnormal be for you and when should you be going to the ER versus just sitting tight and game planning in clinic or by phone or whatever. Now, the third question I'm going to say up front is not for everyone, but if you're someone who really likes to prepare, likes to know exactly what you might be dealing with so you can research, this is a question for you. And that is this. Is your doc worried about anything in particular? What are they looking for specifically? Essentially getting at, is there a warning shot here? Like, is something potentially serious going on that they're trying to figure out more information about? Now, again, not everyone wants this up front, right? If you might have cancer, a lot of people would prefer to wait until they do definitely have cancer to cross that bridge. Whereas other people, if it's a maybe, then they want to know and they want to start preparing. So you just got to be honest with yourself about which person you are and whether or not you would benefit from that warning shot or if it would just gonna send you into a spiral. Last bit I'll say about the warning shot question, though, is if you ask for your doctor's opinion on is there something you should be worried about, and you start to get some long, rambly answer with no clear answer at all, then check out my other video on how to handle that, because there may be something deeper there that you need to unearth. All right, well, I hope having these 3 questions will make you feel a lot more prepared for next time you're going to get any sort of testing done, and just give you that much more confidence for what to do with that notification when it buzzes on your phone. All right, thanks so much for watching.